Hi, welcome. I see we have you in for an ear, nose, and throat exam today. Well, come on in and have a seat and make yourself comfortable. I'm just going to grab a pair of gloves here real quick. So what brings you in today for this exam? Have you been ill lately? Have you been having any issues with your hearing or your sense of smell or any kind of issue swallowing, sensitivities to hot or cold with your teeth? No? Just routine? Okay. Have you ever had an ear, nose, and throat exam before? No? It's very simple. I'm just going to inspect your ears, looking for any abnormalities, making sure everything is in perfect working order. That will include a hearing test. And then I'm going to look at your nose, which will include looking inside of your nose, but do not worry, I will be very gentle, palpating your sinuses and looking for any issues in that region. And then moving on to your throat, I'm going to take a look inside your mouth, make sure everything is looking nice and good. And I'm going to take a look at the back of your throat, looking at your uvula, and then I'm going to also assess your swallowing ability, okay? All right. So for the first part of the exam, I'm going to take a look at your ears. Do you consent to me touching you? All right, great. So all I'm going to do is I'm going to come over here first, and I'm just going to inspect the outside of your ear here, your auricle, looking for any kind of abnormalities. Not seeing anything good. Just going to gently palpate down the ear to the lobe. Good. Good. Let's look at the other side here. Same thing. Just going to physically inspect the auricle here down to the lobe, palpating. Texture of the ear is good. Good. So, nothing looks bad on the outside. However, we are going to have to take a look on the inside. So I'm going to use my otoscope here, my little light. Just going to look inside your ear, make sure everything looks great. I'm sure it is. So I'm just going to come over here and I'm going to slip my otoscope in nice and gentle. Nice and gentle. Okay. Ear canal looks good. Good. Tympanic membrane looks nice and pearly. Good. 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 Wonderful. Let's take a look at the other side. And over here, same thing. Slipping the otoscope in gently. And ear canal looks good, looks good. Tympanic membrane looks nice and pearly as well. A little wax buildup in here. A little bit of wax buildup, but nothing to be concerned about. You should maybe get your ears cleaned. Have you ever had that professionally done before? Highly recommend it. I'm just going to put this away. Now that we've examined your ears, and I've determined that they are in beautiful condition, not seeing any sign of any abnormalities or anything that could cause you an issue, so we're going to move on to the hearing test portion of this exam, okay? So we're going to do 3 different hearing tests with you. The first one is very simple. I'm going to ask you to close your eyes, close your eyes, close your eyes. And I'm just going to make a noise or whisper a word in either ear. If I make a noise, indicate that you hear it. If I whisper a word, I'd like you to repeat it back to me. Okay? Alright. So test number 1. 1. 1. Close those eyes. Close those eyes. Close those eyes. Good. Now, I'm going to make a noise in an ear. Just hold up a finger or tell me which ear you heard it. Good. Good. Coconut. Good. Good. Chocolate. Good. Excellent. Sleep. Good. Relax. Very good. Good. Yes. 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 Wonderful. Excellent. Go ahead and open your eyes. Alright, we passed that with flying colors. So the next test number 2, is going to be a tuning fork exam. So I'm going to use this tuning fork here. As you can see, I'm going to ring it, ask you to close those eyes of yours again, hold it up to an ear, and I'm going to ask you to tell me when you can no longer hear it, okay? Alright, let's go ahead and close those eyes for me. Here we go. Good. Very good. Wonderful. Great. I have one more tuning fork here. This little one, a little bit higher pitched. And we're going to do that again. So close those eyes for me. And here we go. Good. Good. Wonderful. Great. The next portion of the exam is going to be the hearing tone test. So I'm going to go grab a pair of headphones and I'm going to get them over to you and we're going to go through the rules of that exam. I'll be right back. Alright, so for the next portion of the hearing exam, I'm going to ask you to put these headphones on, alright? So here, go ahead and put those on for me. Good. Good. Alright, so what's going to happen is I'm going to play a tone into the headphones. It's going to ring in one of your ears, and when you hear it, I just need you to lift a finger and indicate that you do hear it in that ear, alright? You're not going to be able to hear me during this portion of the exam, so just look at me, pay attention, and raise a finger, alright? So I have my tone dial over here, and we're going to begin in 1, 2, 3. And I'll just take those back. Well, you did wonderful. Got every single one right. I told you. Very simple exam, very routine. You're going to pass with flying colors. But the next portion of the exam, we are going to have to take a look inside that nose of yours. So, I'm just going to grab a smaller attachment for my otoscope here. Now this may be a tad bit uncomfortable, but I promise it'll be quick. So just tilt your head back for me. I'm just going to take a look up each nostril. And let's take a look. Okay, not seeing any inflammation. A bit of mucus buildup, but that's okay. Other side. Yeah. Fairly normal, a little bit of excess mucus. Do you have a lot of stuffy noses? Yeah, it's pretty common. Alright, so again, I'm going to have to touch you if that's okay. Alright, so all I'm going to do here is palpate down along your nose, under your eyes, along your sinuses. You let me know if it hurts at all. Okay, I'm just looking for any signs of inflammation or any bumps that shouldn't be there. So just hold still. I'm just going to press press, 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 press. Good. And under the eyes here, press. Any pain? Good. Oh, don't mind that. That's just the office therapy dog snoring in the background. He's here to help our patients feel more relaxed. You'd be surprised how many people get apprehensive at the doctors. Wonderful. Well, nose looks great. Any issues with your sense of smell lately? Wonderful. Alright. Final portion of the exam. The throat examination. So again, I would like to touch you. Okay, thank you. All I'm going to be doing is feeling right your neck. First, I'm going to be looking for your lymph nodes. Making sure nothing's swollen. I'm going to move on to your throat and then we'll take a look inside. So, straight at me. Look straight at me. Look straight at me. Good. Feel up around your jaw here. Just working my way from the back to the front. Just palpating, palpating. Any pain? Okay, good. The lymph node over here is a little swollen. You suffer from allergies? Yeah, it's that time of year. Pollen's a little crazy. Okay. Otherwise, everything feels good. I'm going to move down here to your neck. Going to feel around to the back of your neck. And over around the sides. Just feeling for anything unusual. Any odd possible growths, which not feeling anything out of the ordinary here. Okay, good. Good. Now this is going to feel a little odd. I'm going to take 2 fingers on each side of your esophagus here, and I'm just going to palpate gently, okay? It's going to feel a little odd, but here we go. Just palpate, 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 palpate. You're doing great. We're almost done. Good. Alright. Now we're going to do a quick swallow test. First one, I'm going to hold my thumbs back behind your jaw here. And I'm going to run my finger along your jawline. I'm just going to ask you to swallow for me. Clench that jaw and swallow. Good. One more time. Good. Now this one is going to be a little weird too. I'm going to take my hand, I'm going to push against the side of your esophagus on each side and ask you to swallow, okay? Alright, here we go. Just going to push gently, swallow. Very good. Push gently, swallow. Very good. Alright. It's time to take a look inside that mouth and look down your throat a little bit, okay? I know. It's not everyone's favorite, but we gotta do it. Alright? Just hold still. It's not gonna take very long. I even have a special light that really lets me see everything. So I'm gonna grab everybody's favorite thing. The tongue depressor. Just gonna get this opened up here. Well, that didn't open the way I wanted it to. But that's okay. The end result is still the same. It's kind of like life. Sometimes we get to our destination in a manner we didn't always see coming. But anyway, enough of waxing poetic. Let's open up that mouth of yours, please. Open, open. Alright, give me a big ol' ah. Good. Keep going, ah. Stick that tongue out. Good. Keep that mouth open. Good. When was the last time you go to the dentist? Do you go every 6 months for a cleaning? Take a little closer look at something. So this is a different type of depressor. So I'm going to ask you to say ah again. And I'm going to hold your tongue down with this one, and this one's going to go a little farther back. I promise I will not gag you. And let me just take a look. I am seeing a little redness. And I'm almost done. Okay. I may want to take a swab, just to be on the safe side. It's probably just a little bit of strep. But I do want to take a look at those teeth of yours. I did notice something that you may want to get checked out. So I'm just going to throw on my little mirror light here. Please say ah. Open, open. Just going to take a look inside. Yeah. I think you might actually have a little bit of a cavity on that tooth. Definitely recommend a dentist appointment. We work with a few. We can set you up. Won't be a problem. But I want to take a look at that tongue of yours real quick. So all I'm going to ask you to do again, say ah, stick your tongue out. I'm going to just grab it real quick, move it side to side, look up and down. Just make sure everything looks good there. You'd be surprised how many little things can hide out on the tongue. So we just want to be thorough. So go ahead, open that mouth for me. Stick out your tongue. And boop, got your tongue. Just gonna move it side, up. There. All done. Well, my friend, I gotta say, you seem perfectly healthy to me. Your ear, nose, and throat are perfectly fine. A little redness. We do want to take a swab. If you wouldn't mind holding still 1 second while we do that real quick. I apologize. I almost forgot. Alright, we're going to take a little quick swab, okay? So just open, open, open for me. Just going to take a quick swab. 1, 2, 3. Swab, swab, swab. Great. Just going to pull up that to the specimen container. We'll get that off to the lab. Get that checked. I'm sure it's nothing. Could just be a little irritation, but better safe than sorry. But other than that, definitely recommend you go get a teeth cleaning. Maybe get a professional ear cleaning just to treat yourself. It does feel really good. Your ears aren't in bad shape though. But otherwise, you're perfectly healthy. So please, enjoy the rest of your day. Drink plenty of water. We'll see you again soon. Have a great day. Bye-bye. Hi. Welcome. I see we have you in as a referral for an ear cleaning. I understand you just had an ENT exam. Great, come on in. We were expecting you. We got a quick text from the doctor down the hall. We figured we'd see you soon. I'm glad you could come in. I'm all set up, gloved up already. So take a seat. Let's check out those ears, shall we? Great. So do you mind if I touch you? Okay, thank you very much. I'm just going to come up here and check your ears real quick. Do you have any pain? My touch and palpate around your ears here? No? Okay. If I cup them like this, any pain? Okay, good. If I just tap on them gently, squeeze the earlobe. I'm not seeing any visible issues. I'll take my otoscope here, just turn that on, and take a look inside each ear, see what we're working with, and then we'll get those all cleaned out for you, okay? So I'm just going to scoot up right close to you and gently going to slip the otoscope inside your ear. I'm just taking a look here. Oh yeah, we definitely have some wax in there we can take care of. It's not a problem. Should be simple enough. Okay, let's take a look at the other side. And same thing over here, just slipping. Otoscope in so gently. Taking a look. Yep. A little bit of wax in there we can take care of as well. So my friend, this is going to be a very simple, very easy ear cleaning. I'm going to go in there first with my tools. We're going to scrape out what we can see that's accessible and easy to come out. And then if needed, we'll use a little hydrogen peroxide solution to rinse out those ear canals for you, okay? Oh, don't worry, that won't hurt. It actually feels kind of tingly. And it actually sounds kind of cool too. So I won't worry about it. But let's get started cleaning those ears out. So I have a couple tools here. A couple tiny little scrapers. And my favorite one, a wood scraper. I also have some very, very tiny tweezers in case there's anything that needs a little extra tug. Our cotton swabs, of course. And then what I like to call a polishing brush. And if needed, I do have a very, very slender tool to help get anything that's very, very stuck. So I'm going to come over to this side. Just going to grab my otoscope for some light, and we're going to get working on that ear, okay? Alright, so hold still for me. Feel free to close your eyes while I just get to work over here, okay? Anything hurt at all? Okay, good. I think we're gonna have to go with this scraper. Something seems a little stuck in there. Let's see if we can get that out. Here we go. There we go. Let's take a look back inside again. Take a look. A little bit better. I definitely want to do a peroxide flush though. Alright, let's scoot on over to the other side. And we'll take a look over here. So same thing. Just hold real still for me. That ear seems to have something stuck a little deep inside, so I'm gonna grab my very slender tool here. We're just gonna basically what I'm trying to do is poke that little piece of wax and try to hook and pulling out. Please let me know if this hurts at all. I'm trying to be as gentle as possible, okay? Alright, stay still. There we go. Still one little thing stuck in there. Let me just hold still for me. You're doing great. Okay. You doing all right? All right, good. I'm just gonna go in real quick, swab out each canal real fast. Again, this is just picking up any loose debris. And you'll notice I do not go into your ear canal. You never go into the ear canal with a Q-tip, no matter how good it feels. That's just to clean up all the excess wax that I pulled to the front of the canal. Okay, so we're going to do a little hydrogen peroxide wash, alright? Don't worry, it's not going to hurt at all, I promise. It's very simple. So we have here is this tiny little squeeze bottle. This is a blunt tip. It is hollow. This is filled with hydrogen peroxide. What I'm going to do is squeeze it into your ear canal. It's going to go in, flush out all that wax that's left over. And don't worry, I'm going to catch the excess moisture with this bowl held right under your ear, okay? It's going to be fine. Don't worry about it. So just stay still. Let's start on this here. Alright, here we go. 1, 2, 3. Yeah, it's gonna make some funny noises. It's almost done. We're almost done, I promise. Alright, that's that ear. Let's grab a swab real quick. Just swab up any excess moisture. Okay. Gonna grab another bottle here. Same thing. Just stay still for me. It's alright. I know it feels weird. It's all done. All done. Just gonna swab up that excess. I know. Just gonna go into your ears again real quick. Just going to swab out all the extra moisture on the outside. Good. Take a quick look inside again. Much better over there. And much better over there. Why don't we do a real quick hearing test just to assess, make sure that you don't have any moisture left inside and you're not experiencing any kind of blockages, okay? So this will be real quick, real easy. Just close those eyes for me. Just going to make a quick sound in each ear. Just hold up a finger on which side you hear it on, okay? Alright, here we go. Good. Very good. Good. Alright, now let me know how this feels. Keep those eyes closed. Keep them closed. And one more time. Just relax. Keep those eyes closed. And one more. Good. Keep those eyes closed. One more test. I'm going to whisper a word in each ear. You repeat it back to me, okay? Alright. Keep them closed. Relax. Sleep. Good. Dream. Good. Coconut. Very good. Chocolate. Great. Vacation. Wonderful. Adventure. Perfect. Alright, go ahead, open your eyes. How you feeling? Everything sound good? Wonderful. Well, as I said, quick and easy. You're all set. So make sure you keep those ears cleaned. Remember, Q-tip does not go inside the ear. Q-tip is for outside the ear. Alright? Alright. If you ever need those ears cleaned again, you know where to find us. Make sure to hydrate. Keep those ears cleaned. And you have a wonderful rest of your day. We'll see you soon. Bye-bye.